if a clinician gets set up with us, it's then possible for them to order devices that get sent to their patients. So we can send them directly, or we can send them a bulk number of units that they can have to hand, and they can, because sometimes the clinician wants to, be able to give the device directly to the patient if they're coming into their office. And in this instance, then the clinician is also able to avail of reimbursement. So there's reimbursement for the breath tests, for breath tests that have been done traditionally. So it's the same reimbursement codes. And something we're also doing more and more is where the device is being used from a remote physiologic monitoring perspective. So that sort of RPM idea is something that's getting increasingly, because these are conditions like IBS, SIBO, functional constipation. These are conditions where it really makes sense to track the patient over a period of time, like the way it should be for patients who are coming in. And it could be something like half of patients coming into gastroenterologists but have conditions that would be relevant to what we're doing. So for those patients coming in, if we can give them the technology where they can go home, gather data over a period of time, and use that to manage treatment. So for example, if that were, if they were to take over-the-counter supplements, like identifying which are helping them, if they were to take different medications, help the clinician choose which would be most beneficial. It could be just purely food related. So deciding whether this patient is a good candidate for example, a low FODMAP diet, or maybe another type of diet that might be more suitable for the patient. If you're able to guide the patient over a period of time through that process remotely, it's something that will cost a lot less money. It's something that will be much more effective for the patient and for the clinician as well, just the satisfaction of being able to treat the patient really effectively, because these are really hard to manage patients because they're really complex conditions.